Hi, good morning. This is Dr. Hindwara, and I'm with Dr. Alex Manjarian. Um, I can't keep track of the number of videos. I think this is the fifth one. The previous video was regarding insular cortex. I hope that was helpful. Today, we are going to talk about the neurobiology of depression, and I'll try to make it as simple as possible, but also capture some of the high yield according to recent research data. Research work keeps changing, so I want people to be aware of that. What I talk today might change few months or few years from now, but the current understanding of the depression is as follows. But before we go dive into neurobiology of depression, I again want to point out some areas of the brain that we are going to talk about. And I want the audience to know where exactly they're located and what do they do. So this is going to be repetition, but I believe in the more we repeat, the better it is actually for us to consolidate the information. So one of the area of the brain that I'm going to talk about will be in neurobiology of depression will be the dorsolateral prefrontal cortex, right? So this is dorsolateral prefrontal cortex. This is going to be an important area of the brain that we are going to talk about again and again during our talk. So the function of the dorsolateral prefrontal cortex is top-down control of emotions, attention, right? So if we lose the functioning of the dorsolateral prefrontal cortex, we lose that top-down control over our emotions, right? Apart from this, dorsolateral prefrontal cortex also plays an important role in working memory. It's also required for abstract thinking, right? Thinking that is not concrete. It's also required for task shifting, right? Shifting from one task to another. So it has a lot of higher cognitive functioning. So now we are going to focus on orbitofrontal cortex. This is going to be the main player in this particular video. And we talked a little bit of detail as to like what these areas represent. Now, these are an MRI scan, three different view. So the one actually that you see right now, the pointer, that is the sagittal view. And you see the orbitofrontal cortex in red, as this is the anterior part of the brain, and this is the posterior part of the brain. So you see the occipital cortex, you see the cerebellum, so you know it's a posterior part of the brain. This is the lateral ventricle right here. And the orbitofrontal cortex sits at the base of the forebrain. The second view is the coronal view. And you see the frontal lobe, you see the orbit, right? As soon as you see the orbit and you locate the frontal lobe, the area of the brain that is sitting right above the orbit at the base of the frontal lobe is the orbitofrontal cortex, right? So if you look at the orbitofrontal cortex, the part of the orbitofrontal cortex that is located medially, which is in blue right here, is the medial orbitofrontal cortex. Some literature will say that it's a part of the ventromedial prefrontal cortex. So the medial orbitofrontal cortex, which we'll call medial OFC, is responsible for processing reward. And we are going to talk about it, that this particular area of the brain in depression will show hypofunctioning. That means that the depressed brain is not able to process reward related information. Just lateral to the medial orbitofrontal cortex, this will be in green, is the lateral orbitofrontal cortex, and the lateral orbitofrontal cortex is also considered to be a part of the ventrolateral prefrontal cortex. The lateral orbitofrontal cortex is responsible for processing aversion or punishments. And this particular area of the brain is hyperactive in depression. And this makes more sense because a depressed brain will usually process aversive signals or punishments, right? Any emotional signals that has a negative valence to it. So we know where exactly the dorsolateral prefrontal cortex is located. We know the function of it. I want you guys to remember one function while talking about depression is that the dorsolateral prefrontal cortex is hypoactive in depression, and that's why we lose the top-down control of emotion as well as attention. We talked about orbitofrontal cortex. The medial orbitofrontal cortex is responsible for processing reward, which is hypoactive in depression, and the lateral orbitofrontal cortex is responsible for processing aversion, which is hyperactive in patients with depression. Now we are going to talk about another area of the brain, which is extremely important, which is called precuneus. Now this area of the brain is also a part of your default mode network that Dr. Alex Manjarian is going to talk in one of the videos that will be coming soon. So where exactly is this precuneus located? So we are going to focus on the last MRI section. Let me get a pointer. So the one actually in the red pointer. So this is the sagittal section that we are going to talk about. First, we need to locate some of the sulci, which will make it easier for us to locate where exactly precuneus is located. I'm going to use a red marker. So first, we need to know where exactly is the parieto-occipital sulcus. So this will be in red. So the sulcus that you see right here that separates the parietal lobe from the occipital lobe is called as the parieto-occipital sulcus, right? Then you have another sulcus which is running right here in the occipital lobe, which is called as the calcarine sulcus. Between the parieto-occipital sulcus, which is right here, follow the pointer, and the calcarine sulcus, I'm going to shade in green, is the cuneus. Okay. Underneath the cuneus is the lingular sulcus. And then we locate another sulcus. We know that right above the corpus callosum, so follow the pointer, this is the corpus callosum right here, right? You have an area of gray matter which is called as the cingulate cortex. We talked about it right here. Look at the sulcus which is right above the cingulate cortex. We're going to follow the sulcus which is in red. This is the cingulate sulcus. So now we know exactly where the cingulate sulcus is. So the one, follow the pointer, that is the cingulate sulcus. And right below the cingulate sulcus, we'll try to do it in green, is the cingulate cortex. And between the parieto-occipital sulcus, follow the pointer, and the cingulate sulcus, there is a gray matter zone, which we are going to color in blue, is the precuneus. So it's a medial part of your parietal lobe, the precuneus. So the precuneus, along with the posterior cingulate cortex, forms the default mode network. So what is the function of the precuneus? And plus it's called precuneus because it is right before the cuneus. So this is the cuneus, right above it or in front of it, it is the precuneus. Okay. So what are the function of the precuneus? So precuneus as the default mode network, it's responsible for self-referential thinking. Ignore the spelling. So it's required for self-referential thinking. It plays an important role in autobiographical memory. It's also responsible for the sense of self. It plays an important role. It's a part of the parietal lobe, right? So parietal lobe plays an important role in visuospatial processing. So it also helps with navigation, especially spatial navigation. So these are the basic functions of the parietal lobe, the precuneus, sorry. Now, what I want you to remember is two things in here when we talk about depression. One is I want you guys to remember the self-referential thinking about self and the sense of self. These are the two things that we are going to talk about because in patients with depression, they usually have a negative self-referential thinking and they have a low self-esteem or low sense of self, right? And we will see as to like how does precuneus play an important role in this particular process. So now we know what the precuneus does, right? So we know it's a part of the default mode network required for self-referential thinking as well as self-esteem. Those are the two areas we are going to focus on. Now let's look at another area of the brain that we will be talking about during our neurobiology of depression is the angular gyrus. So how to locate the angular gyrus, like where exactly it is located. So first we'll have to locate where the Sylvian fissure is located, right? So Sylvian fissure, I'm going to draw in red. So this is the Sylvian fissure. So what the Sylvian fissure does is that it usually separates your frontal lobe from your temporal lobe, right? That's a Sylvian fissure. And as we know, if you take an operculum and you move the frontal lobe as of the parietal lobe upwards and you pull the temporal lobe downwards, inside there is a cortex, a gray matter that is visible. It's called insula, and we talked about insula in detail in our previous video. So once you locate the Sylvian fissure, right? There's another MRI slide. So where exactly is the Sylvian fissure here? So this is the Sylvian fissure right here in red. All right. So once you locate the Sylvian fissure, then I want you to focus on an area of the brain that sits on the distal end of the Sylvian fissure, the green one right here, right? I want you to focus on the green one. So the area of the brain that sits on top of this distal end of the Sylvian fissure, which looks like a horseshoe, that's your supramarginal gyrus. We're not going to talk about it in depression, but it will actually come. We'll talk about it sometime later in some of the other videos, but I want you to know where exactly it is located. Right below the sylvian fissure in the temporal lobe, you see a sulcus, which is called as a superior temporal sulcus. The superior temporal sulcus usually separates, not usually, it separates the superior temporal lobe from the middle temporal lobe. That's what it does. Let's look at the far right MRI brain. This is the superior temporal sulcus. Right? So the area of the brain, which will be now shown in blue, that sits on the top of the distal end of the superior temporal sulcus, that is your angular gyrus. Okay. Now, what is the function of the angular gyrus, and why are we talking about it in depression? Angular gyrus plays a very important role in language or semantics. Right. So we know that in patients with depression, there will be an increase in the verbal expression of how you feel, right? Especially the verbal expression of negative feelings or punishing feelings or negative memories. So now we know what exactly the function of the angular gyrus is, and I'm sure you guys are expert actually in locating where on an MRI scan. So just follow the superior temporal sulcus, and at the end of it, actually the area of the brain that sits on it is the angular gyrus, which plays an important role in language as well as semantics. Now let's look at amygdala. This is another area of the brain that we are going to talk about in patients with depression. And the amygdala is usually hyperactive in patients with depression. And that makes sense, right? Because amygdala is something that processes our emotions, especially emotions related to threat or any kind of negative stimulus. So let's see where exactly it is located. So we have the MRI scans here. Now you guys know the different views. I'm not going to repeat that. Let's look at the scan that is on the extreme left side. How do we locate the amygdala, right? So when you're looking at the axial scan, look at the midbrain, right? It has a shape that we cannot forget. It looks like a little Mickey Mouse, right? So when you look at the midbrain, which looks like a little Mickey Mouse, right medial to it is your anterior medial temporal lobe, right? So this is the anterior medial temporal lobe right here on either side, right? The one that is in green is your amygdala, and the one in pink is the hippocampus, right? So the amygdala and hippocampus sits on the anterior medial part of your temporal lobe. Now this is an axial scan. So you see the same thing. This is your anterior medial part of the temporal lobe. The green one is the amygdala. The pink one is the hippocampus. The amygdala sits on the anterior tip and dorsal to the hippocampus, the tip of the hippocampus. Okay. Same way, actually, if you look at this scan, right? Now, I'm not going to focus on the coronal section here because there's a better way of recognizing amygdala. So this scan can be a little bit confusing. So I want you to ignore this extreme right-sided scan. Now, what's the function of the amygdala and what role does it play in patients with depression? So amygdala is usually responsible. So what happens is that we know while we're talking about insula is that whenever there is a stimulus, any kind of negative stimulus, the amygdala will get stimulated, because this is also called as the innate alarm system of the brain, right? So what the amygdala initially does is that it usually gives a valence to a particular stimulus, classifying it as bad or good. And it will also give a salience to a particular stimulus. Salience is basically whether it is important or it's not important, right? That's what the amygdala does. And with the help of the insula, it's able to actually get more information, because the insula is also going to tell the amygdala about the context. And based on the context, the amygdala is going to modify the physiological and the emotional response to a particular stimuli. And in depression, the amygdala is hyperactive. The reason why the amygdala is hyperactive in depression is that we talked in this particular video that the dorsolateral prefrontal cortex is hypoactive in patients with depression. And the dorsolateral prefrontal cortex is responsible for top-down emotional control. So it's responsible for modulating the function of the amygdala, or the way amygdala processes emotions. And we have talked about it in detail in one of our videos about the cingulate cortex. So if you want to know exactly how it does, please refer to that particular video and see how the top-down control is lost, especially when a person is stressed. Perfect. So now we know what the amygdala does. Now let's focus on the cingulate cortex. And this is all revision. We have had previous videos where we talk about the cingulate cortex in detail. Now again, let's see anatomically where exactly it is located. So we have an MRI scan. So let's start on it's the same kind of scan. Follow the pointer. The red pointer is your corpus callosum, right? This is the posterior part, anterior part. So the area of the cortex that is located above the corpus callosum, so these are corpus callosum right here, is the cingulate cortex here, and we have cingulate cortex here, right? The cingulate cortex, as we all know, is divided into three parts. So the anterior 1/3 of the cingulate cortex is called as the anterior cingulate cortex, which is right here, the anterior cingulate cortex. The middle 1/3 is called middle cingulate cortex, and the posterior 1/3 is called posterior cingulate cortex. But we are going to talk about the anterior cingulate cortex here and here. So the anterior cingulate cortex is divided into three different parts. So the one that we are going to focus on, not one, the two of them all three of them that we are going to focus on, is going to be the part that is, I'm going to mark in red, of the cingulate cortex that sits right beneath the corpus callosum. So this is the genu of the corpus callosum because it bends like a knee. If you look at his knee, looks something like that. So that's called genu. So the area of the cingulate that is present just underneath the genu of the corpus callosum is called subgenual cingulate cortex. Which is also a part of your ventromedial prefrontal cortex. And we know, according to the previous videos, that this is the area of the brain that also usually modulates the functioning of the amygdala. So it's responsible for the top-down emotional control, right? And this in turn is modulated by the dorsolateral prefrontal cortex, the subgenual anticingulate cortex. Then let's look at the other area of the brain that's shaded in blue, which sits right in front of the genu of the corpus callosum. And this area that is shaded in blue is the pregenual anterior cingulate cortex. Pregenial means right in front of the genio of the corpus callosum, right? Which in turn sends glutaminergic projection to your subgenial anterior cingulate cortex. And the third area of the anterior cingulate cortex is the dorsal anterior cingulate cortex, right? Which is also written as dorsal anterior cingulate cortex. And this is a part of your salience network. That Alex is going to talk about. I is right here, salience network. So patients with depression, there is an increased activation of the subgenial anterior cingulate cortex. And there is also an activation of the dorsal anterior cingulate cortex. In a healthy brain, the subgenial anterior cingulate cortex is responsible for processing reward. Pregenial is also responsible for processing reward. Whereas the dorsal anterior cingulate cortex will process aversion or an aversive stimuli or punishments.